I presented data from the first-in-human, first-in-class, phase 1, 2A study of the next-generation CDK4 selective inhibitor, PF-07220060, in patients with advanced solid tumors, which was enriched for HR-positive, HER2-negative metastatic breast cancer patients who had progressed on prior CDK4/6 inhibitors and endocrine therapy. The rationale here is that CDK4/6 inhibitors, when dosed with endocrine therapy, have significantly improved progression-free survival and overall survival for patients with HR-positive, HER2-negative metastatic breast cancer. However, despite the initial clinical benefit, development of treatment resistance is common. So PF-07220060 is a next-generation, highly selective CDK4 inhibitor with significant sparing of CDK6. And because of its greater selectivity for CDK4 over CDK6, PF-07220060 leads to less neutropenia in vivo models and consequently can be dosed higher to attain tolerated plasma concentrations that exceed those reported for dual CDK4/6 inhibitors. Preclinical tumor models have shown that PF-07220060 effectively suppressed tumor growth in palbociclib and endocrine therapy-resistant models. In our results, PF-07220060 plus endocrine therapy showed efficacy in patients with HR-positive, HER2-negative metastatic breast cancer who had progressed on prior CDK4/6 plus endocrine therapy. And the tolerability of PF-07220060 alone and in combination with endocrine therapy was encouraging, and PF-07220060 plus endocrine therapy exhibited modulation of pharmacodynamic biomarkers. Dose expansions with PF-07220060 plus endocrine therapy in patients with HR-positive, HER2-negative metastatic breast cancer, patients post-CDK4/6 inhibitors, and in CDK4/6 inhibitor naive patients are currently ongoing.